Another question on the Affordable Care Act. The ACA notably led to a significant reduction in the number of uninsured Black Americans. However, there are still millions of Black Americans who don't have insurance, and there remains a significant gap between uninsured Black Americans and white Americans. Healthcare policy experts say that states expanding Medicaid could significantly close that gap. Can you talk to some of the inner workings in the administration to push states to expand Medicaid? And are there other ways that the administration can ensure that there's a reality for Black Americans to have affordable healthcare?
Yeah, and this is why the president's economic policy is what it is, which meaning that he has had a policy, again, make sure that we have an economy that is from the bottom up, middle out, and not leave anybody behind. Communities that you're talking about right now, the African American community and other communities across the country. But I'll say this: as we've seen some progress made under ACA by lowering healthcare prices, increasing the number of Americans with insurance, and capping out-of-pocket drug costs for seniors on Medicare. That is something that this administration has worked on this last 2 years. And it brings me back to the Inflation Reduction Act, right? How important it is, especially for many members of the Black community. When you think about Medicare being able to lower cost for our seniors across the board. When you think about the insulin cap for Americans. That's what you saw from the Inflation Reduction Act for seniors in particular. And then you saw Eli Lilly, what they were able to do, and others, what they were able to do for all Americans. That's because of the work that this president has done. And so we understand that there's still millions of people that need a lot more. But because of the president's economic policy, because of his understanding of what healthcare means to people, his personal understanding of that, he has done the work to make sure that people who are normally forgotten are not.